This panel is sponsored by Winona, which is a telehealth company who takes the confusion out of the menopause and helps women get the solutions they need. So Adrienne is also moderating this panel, and she will be joined by Nicole Garrett, who is the COO of Under Pressure Hyperbarics. I'll be honest, I don't actually know what a hyperbaric chamber is, but I'm sure we're going to find out. Dr. Kathleen Brown, who is medical director at Winona and a board-certified OBGYN. Jessica Shepherd, who is also an OBGYN and founder of the Modern Meno. Heidi D'Amelio, who is an entrepreneur and influencer, who has 9.9 million followers on TikTok, I found out last night after stalking her. And Erica Shannon Hathaway, who is a certified menopause coach. A round of applause for our panel.
She's just a girl and she's on fire, hotter than a fantasy, lonely like a highway. She's living in a world and it's on fire, filled with catastrophe, but she knows she can fly away.
I am so excited for this next panel. So we just heard, here's the mic, we just heard about women and wealth, and now we're going to talk about women and health, right? This is such an important topic, and I can't thank our sponsor, Winona, enough for bringing these brilliant, beautiful women to the stage. Everybody here is just gorgeous, right? I mean, my gosh, I just feel so lucky to be surrounded by this beauty. Okay, so we are talking about health today and why it's so important for women entrepreneurs. So I'd actually like to start with Dr. Kat, who is the medical director we just heard from Winona. Can you please give us a little insight into why it's so important for us as women, especially at this stage of our entrepreneurial journeys, to really take care of ourselves?
Well, you can't pour from an empty cup. I mean, that's basically the bottom line. We put so much energy and so much effort into everyone else around us, and especially when we're like reaching the pinnacle of our career, we put so much time and energy into our work. But if we don't take care of ourselves and really take time for ourselves and do what makes our body feel good and really help ourselves, we're not going to be able to continue at the pace that we want to. So I think that's why it's so crucial.
And I would just love for you to educate us a little bit on Winona. So
Sure.
When we know Winona is a telehealth company, but can you tell us even, what does that mean? What is a telehealth company?
Well, so telemedicine, we learned during COVID and during the pandemic that, access to care became such a huge issue. Telemedicine helps bridge the gap so that you're not having to wait for 2 to 3 months to see your physician, to make an appointment. It makes access to care so much more readily available to patients because it brings it into their home, right on their home computer or on your phone even. So you can go through and onboard on the site, and within 24 hours, you have a doctor contacting you, talking about your medical condition, going over your symptoms, reviewing everything with you. So it really brings medical care more immediately available to patients, which has been a huge need, especially for women's healthcare and especially in midlife. We know that there's just such a lack of focus on taking care of women in the midlife transition and perimenopause and menopause. It's a huge need across the country and across the world, really. And so we were founded to help bridge that gap and bring care to patients who need it.
Amazing. And so Winona is obviously not an OBGYN. You can't do that in a telehealth manner.
Right.
Even though that would be interesting.
Well,
AI, anybody?
Right. You still need to maintain an in-person physician to do your screening medical exam. You need to have a breast exam regularly. You need to have a pelvic exam. But this is complementary to that. So a lot of OBGYN care doesn't actually need a physical exam. And part of that is reviewing symptoms of menopause is what we do. Perimenopause, you don't necessarily need to have a full physical exam. Now, one of our disqualifying questions when patients are onboarding, though, we want to know, have you seen your doctor in the last year or two? Because if you haven't, my first response is, please make an appointment. Like, you need to make sure you're keeping up with your physical health.
Yeah.
And we can help with the symptom management, with HRT, with hormone replacement therapy, but I can't examine you through the computer.
No.
We don't. We don't
Nor
want
would you want to
telemedicine
try.
visits for
Not
that.
yet. Not yet. That might be coming in the future. You never know. Actually, I wanted to turn to Dr. Jessica Shepherd and talk a little bit. You're both a physician and an entrepreneur. Mm-hmm. So can you talk a little bit about your journey to becoming an entrepreneur and how being a physician really helped you to understand how to manage your wellness through all of that?
Yeah, I have been doing traditional medicine for about 13 years before I came to the realization of I wanted to be able to interact with my patients much more. And so the way for me to do that was to have my own practice, which really is a wellness practice, because what we included in the scope of the practice was we have a yoga studio, we have an acupuncturist, we have an esthetician, we have a registered dietitian. And the reason for that was because our lives are so complex. And when women were coming to me and saying, obviously, I need a PAP, or, I just need my well woman visit, the conversation usually has to do much more with what's going on in their life, socially, emotionally, sexually. And so the ability to have all of that in the practice meant that I needed to be an entrepreneur and have my own business, which I will say is daunting.
No joke.
And so entrepreneurship is something that really has to be something of passion and something that you really, really believe in, because on those days when you're just like, I don't want to go to work, is that it's your baby and it's something that you take pride in. And so that transition was actually very hard, because usually it was just you show up at work, you do what you need to do, and then you go home. But what I have realized is that I now am in charge of my wellness and my health. But because even being a doctor, that doesn't necessarily mean that that comes naturally for me because I studied medicine. Wellness really has to do with how do I want to show up in my life later, in my 60s, 70s, and 80s. And that had to be the investment that I was willing to make as an entrepreneur and finding the time for it. A lot of my patients are like, well, where do you find the time? And I was like, that should be how we prioritize health, is that you will find time for it. And even if it's just 30 minutes, even if it's just 5 minutes of meditation in the morning, that's still considered wellness. And finding different ways to put it into your daily life is what you're responsible for, because it's not going to look the same as everybody else. And what is exciting for you may not be exciting for somebody else. So really exploring and navigating the world of wellness so that you can find how it's going to work for you. It's an individual journey. This is a marathon. It's not a sprint. And so if you look at it as long-term investment, it's the same thing that we would say financially. I would never tell you, oh, you know what, start investing in your finances when you retire. No, you'd be like, I have nothing. You want to start that early so that when you finish, that you have something there. And it's the same thing about health. Start now so you have something later.
I love that. And it actually makes me think about a recent meetup that we had actually here at Civic Hall. Is that, first of all, let's just say, is Civic Hall amazing?
Yes, it's gorgeous.
Oh my gosh. Let's give a round of applause. But we had a meetup here at Civic Hall a couple of weeks ago, and Erica really guided us through finding what our pillars of meaning are, so that we can then develop our businesses and our lives around those. And I think that just as a complement to everything that we're talking about from, a medical perspective and also a holistic perspective, Erica really helps women that are going through the menopause journey to really understand who they are inside so that they can build their lives around that. So can you just talk about what role that plays in our overall wellness, especially during this time of perimenopause and menopause?
Absolutely. Menopause and our experience of menopause is not one size fits all. And our goals and dreams and strengths are not the same. Mine are not the same as Dr. Shepard's. We all have a different life experience. And so when we're thinking about caring for ourselves as we progress through the menopause journey, it is so important to lock in with what's truly important to us as we move into this next chapter, so that we can prioritize the things that make us happy, and also by connecting the things that bring us joy and our why, like we talked about in the keynote, we can have a very clear vision of what it is that we need to prioritize to maintain those areas of our life. So example, if I am so motivated to go outside, and being outside makes me feel good, it makes me feel free, and I love playing with my daughter outside and experiencing physical activity outside, then as my coach, I would say, okay, if you're going to maintain your physical activity, how can we get you outside? I'm not going to say get a Peloton membership because you're going to be sitting inside. It's not going to be a success for you. So we determine success based on the things that you know to be true about yourselves.
Yeah.
And that's how we start everything with what I call the menopause vision statement. Determining what your true values are, how they show up in your life, and how you are committing to bring those values with you as you go through the menopause journey, so that you can not only stay true to yourself, but really take care of yourself in a way that's going to be more sustainable for you.
Amazing. I
And
actually
also,
go ahead.
what's today?
Dr. Jessica.
And today is World Menopause Day.
Oh!
No, October 18th, it is World Menopause Day. So just bringing awareness to this beautiful group of women is it's such a privilege and an honor and just a special day. So thanks for being part of it.
I love that. I'm so happy. I actually wanted to throw it over to Heidi, because Heidi is an entrepreneur and an influencer, but she also has children that sort of thrust her into this whole world of having all the attention on you. And I just wonder, women, so many times we put all of our attention on others and not ourselves. So how do you sort of balance that and stay well, because you are growing your own multitude of brands?
That took a little bit of time. For anyone that doesn't know, my kids blew up on social media in fall of 2019. And, I went from stay-at-home mom, like just driving kids to sporting events and dance class, to this is a lot of eyeballs on our family. But I was always a mom first. And so that part of me did not change in all of this. I always, this is part isn't my kid's favorite, but even now we've kind of all gotten comfortable in this sort of world we're in right now. But every year, top of the year, all the doctor's appointments are done. Eyes, vaginas, everything. We're checking them all. Get the dentist, and that's something I've always done with them. So I think to keep the things that I've always done consistent, but to teach them to do it and they really, they a little bit older. They've recently said they could feel their frontal lobes closing. I'm like, I love that for me. And so they are taking those things on their own, which relieves my stress a little bit. I still check in, like, you made those appointments, right? We got to hit them all at the beginning of the year, get it done, get them all done. It's going to be a pain, but let's just get that done. So with, they're 23 and 20, and, I feel like what I've tried to do, probably little bits over their life, is to help them feel confident in their personal care and what they do for themselves. And so my youngest just got a role on Broadway, and she moved to New York. So that is, thank you. She's leaving the nest for sure. Yeah. I mean, but in that, she was telling me, these are the moments that you, as a mom, is I just know to do this and to do it well, I have to take care of my body. And so we talked about, okay, how are you going to food prep? What are you going to do to, if whether it's hyperbaric chamber or whatever you need to do, massages, anything to make sure you prioritize your wellness. And I made a point to tell her, I'm so proud of you for even thinking that, because you have to take care of your body or you're not going to be able to do this. And so I think to answer your question in a really long way is to give them the power to understand. And I feel like I just felt like a broken record for a lot of years, but they were listening and they're taking it upon themselves, which gives me a little more time and like relieves my stress to take care of myself and prioritize. I also have to practice what I preach, which I feel like I do, but when you're kids and you're tending to everybody else, you do neglect yourself. And to prioritize, like, I have to do this for me, put my mask on first so I can take care of everybody else. So
and I just kind of want to understand in the audience, how many of us have, we're sort of you know, I know we did it before, but I don't remember, like 40, who's in their 40s? Okay, who's in their 50s? And sometimes you know, not everybody has children, but when our children get to their 20s, they, you know, it's almost like we feel a little free, right? Because we've been taking care of them so much. And it's at that exact time that our businesses, you know, have the opportunity to grow. And if we don't take care of ourselves, right? I don't really know a lot of parents when I was growing up that you know, moms in their 50s looked like this panel, right? Like 50 back in the 80s looked like 80 today. And so I think that this is like such a great example of what at least just being mindful about your wellness can do for you. And like you're saying, Heidi, you set such a good example, you know, for your children, your nieces, your nephews, whoever it is. And actually, I'm super curious about hyperbaric therapy, hyperbaric chamber therapy. I don't know what it is at all. And so we have Nicole, and she is a certified hyperbaric technologist. So can you please just let us know, educate us, what is that?
Yeah, so most people don't know what it is. That's normal. Or if they do know, they're like, oh, that's the thing we put divers in when they get the bends, right?
Yes.
But it actually has been in medicine since the 1600s. We used to do surgeries in ORs before we knew what oxygen was. Doctors were like, well, the patient's less blue, so that's good. And then we just figured out what oxygen was, and we didn't have to do it under pressure. But basically, we put you in a hyperbaric chamber, and we pressurize the chamber. And by doing that, we're dissolving oxygen in all your body fluids. So you don't need your red blood cells. If you just had surgery and they cut, you know, your blood supply for some reason, you had diabetes or you had cancer or anything that could affect your vascularity, a concussion even, we can kind of cheat how we get oxygen back in your body. And it's the only thing we have in medicine that grows new blood vessels. It's also probably one of the least invasive treatments you'll ever do. You get to go in, if you can go in an airplane and clear your ears, you can jump in a hyperbaric chamber and breathe oxygen. So,
wow. So how can women entrepreneurs, I'm just thinking, okay, how can this benefit us as we are sort of going through our entrepreneurial journey? Is it just another wellness aspect that we should be thinking about?
yeah, it's not just a wellness aspect. I mean, it helps a ton with brain fog. So even myself after COVID, or
who has brain fog?
Right?
Oh my God, are we even paying attention? Because my mind sometimes shuts off.
Yeah, so that's just part of your daily wellness routine. And then there's been a lot of research in the last few years showing it releases stem cells. So it's preventing dementia and treating Alzheimer's. On a DNA level, we're adding length back to the telomeres now. We don't know what that means in medicine, but every year they get shorter. And if we can add length back on, that's pretty huge. So we will see where that develops.
Amazing. So go ahead. Where can you find? Where can you?
So my facility's in Los Angeles. My goal is to open everywhere. That was kind of my goal. I've worked in this field my whole career, almost 20 years now, and it's very inaccessible still.
Yeah.
So the goal is to branch out.
Occasionally you'll find a hospital that might have a hyperbaric chamber, but not even everyone that works at that hospital will even know it exists and where it is.
Right.
Yeah.
It's
100%.
like reserved for the select few patients that maybe they use it for accelerated healing. Mm-hmm. Yeah.
So I'm super curious, everybody here is in the health and wellness arena. How did you all, I'm going to ask a couple of different people, but how did you all get into this field in the first place? And Dr. Kat, I would love for you to share your story because it is pretty interesting.
Sure. I mean, from the time I was old enough to answer the question, when people asked me, what do you want to be when you grow up? It was always doctor. And I can't remember exactly when I sparked that interest, but when you look back at this book my mom kept, it was a school time book, and it's like who your friends are, what your hobbies are, what do you want to be when you grow up? It was always doctor/ballerina, doctor/rock star. Even at like 6 years old, I felt like I could do it all. Like I could be a doctor and be a rock star on the side. How wonderful. So it was always there. I always had this calling to be of service to others and to take care of patients. Then when I got to medical school, my medical school really tried to groom primary care providers. They really wanted everyone to go into primary care, be family doctors, internal medicine doctors, pediatrics. And no matter what I did, I kept gravitating toward women's health. even myself, I mean, I had very negative experiences as a young woman navigating my own reproductive health, trying to go to the doctor and getting care. I think we all maybe have a nightmare story of like a bad GYN visit, right? I mean, everyone's shaking their head.
Yeah.
So when I went through that, and I just found myself gravitating, and all the residents I was working with when I was a medical student found out that, like, hey, I was good at pelvic exams, I was good at pap smears. Patients would tell me everything because I was good at listening, and they would turf all their work on me because they didn't want to do it. They were uncomfortable. A lot of people are just not comfortable in our space. I don't know if you'd agree with that, Dr. Shepard. Like, a lot of other specialties are very afraid of vaginas.
Yes.
Very afraid of bleeding vaginas, especially.
As well they should be.
Just in my own development as a physician, I felt this strong calling that, like, I can actually make a difference for female patients. And if I become a women's health provider, then I could make the experience different for my patients, even if it's one patient at a time. And so that's what I did. And I spent the majority of my career doing full scope obstetrics and gynecology. And then I made the leap to become an OB laborist, which is an inpatient only OBGYN specialist. When I went through a divorce and went through some personal chaos. And I was really forced at that point, because I became a single parent of 3, to finally focus on myself. When my daughter started calling the nanny mommy and called me the nanny's name, I said, okay, something's got to give. I have to completely restructure my life. So I gave up doing full scope obstetrics and gynecology to become a laborist, to have a better work-life balance. And then our chief medical officer at Winona, who's sitting in the back row, Dr. Green, can raise his hand. He worked for the same company that I did. We were working for a national OB laborist company. And he reached out and said, hey, I'm working with a telemedicine menopause company, and we really want to expand into your state in Pennsylvania. We really need a good doctor to provide care for our patients there. And I was like, who is this guy? Who is he contacting me? But then I really, at the same time, was navigating my own perimenopause journey and not getting the help I needed. Even as a board certified OBGYN, going to my family doctor who knew what my level of education was, bringing her data and studies and asking her for help. She kept telling me, no, I don't feel comfortable. I don't feel comfortable. You need to get lab values. You need to do this. You need to do that. I was even turned away as a professional talking to another professional to get my own care, which to me is heartbreaking. And it's like horrible that our medical system is like that. But anyway, I started working for Winona in 2021, and I love it. And patients are so appreciative. And every day I meet new women on our platform that have been told no, that have been not listened to. And so that has become my mission, is to help women, every woman that I can.
I love that. It's so amazing. I feel like this mic really turned on. I was actually going to ask Dr. Shepard about the book that you've written, Generation M. Can you just tell us, a little?
Yes, well, shameless plug. This happens to be right here on the stand beside me.
What a beautiful cover.
So yes, Generation M, it just came out October 1st, specifically because this is Menopause Awareness Month. But really, this is really, I call it my love letter to patients that I've seen over the last 17 years in practice. But going into the perimenopause, menopausal phase has been so confusing and so overwhelming, and I think even frightening for most women. And so the goal of this book really is to change the narrative of what we want to do with this transition in our life, because 40% of your life is spent in the postmenopausal phase. And I think that most women don't even realize that we're living longer, we thrive, our careers are just like starting maybe in our 40s, which is our perimenopausal phase. And so there are a lot that we need to understand about our body in self-awareness, but also pushing back against society that for so long has been telling us, oh, it's just something you're going to go through, or just grin and bear it, or nothing much, just everyone else has done it before you. And I think that is such a disservice to women in what we can accomplish, what we can aspire to, and also understanding the modalities and tools that are out there to actually help us. And as a gynecologist, I found that we really haven't given women our best in what we can offer. I think that we see that in research. We see that in just society-wise, what we think of women and their worth and their value. And I think that needs to change, and it's going to change today, and it's going to change from here on out in what women think of themselves, especially during that phase, because there's so much that changes emotionally, physically. Our bodies are acting different. We're like, what is going on sexually? And if we're not paying attention to it, that's really how we can lose ourselves. And so in Generation M, it really is changing the playbook of what we've used before and giving ourselves the tools through. A lot of it is what we're talking about right now is just our lifestyle changes. But if we're not aware of what those changes should be, then how would I expect you to know that? And then also through nutrition, we cover exercise, and those things actually do change in your 40s and 50s and what you should be doing for your bodies. But again, if you never knew that, then how would we expect those changes to occur? And I just want people to understand that this is like a beautiful chapter in our lives. And I want us to really approach it that way and not as this like dreadful time that we're approaching. I think that's the story that we've really tuned into for so long. And so I wanted to be able to do that through what I've seen in women who I've spoken to in my practice, but also myself as a perimenopausal woman. I was like, how can I change this narrative for myself as well? So that's what Generation M came from. And I hope that you all get a copy of it. It's on Amazon, it's on Barnes & Noble, in-store and online. But yes, it's a beautiful playbook to what, hold it back up. Yes, absolutely.
It's
Thank you
gorgeous.
from the heart.
Yes, yeah, absolutely.
So yes, this is Generation M. And I purposely made it something that people want to be a part of. Like, everyone is going to be a part of Generation M, because guess what? 100% of women are going to go through menopause.
Yeah, absolutely. Yes.
Right?
Yeah.
And we're not going anywhere. We are women. There is going to be more of us, and 100% of us will go through menopause. So why not enter it in a way that you want to live your life in the best way?
Yeah.
And speaking on, yes. And speaking on generational knowledge, I think it's so powerful. I was listening to you, Heidi, talk about how you're empowering your daughters to take care of their health. It's our job to empower our children to know what perimenopause and menopause are,
Yes.
because they are part of our life, and they are not only affecting us, but they're going to affect them too. And so and you know, that we could call it a cruel timing in life when we're going through perimenopause and our kids are going through puberty. Yes, that is definitely something that's happening. But it opens up a door to have a conversation about, it's okay to have these feelings. It's okay to know what's coming. You don't have to be afraid of it. There's so much support out there. I'm here for you. I'm going to tell you what my experience is so that I can pave the way for you to not be so thrown off. I mean, I don't know about any of you, but I didn't know that perimenopause lasted so long until I was over 40.
How about the term itself?
Right.
So many people are like, what is
not
perimenopause?
Yeah.
Yeah.
There's so much that needs to be demystified and reframed. I don't know if anybody knows the statistics about how when medicine is developed, it's sort of tested, if that's the right word, on people that are not women.
Yes.
So
We're little men.
Yeah, we're little men. And can you talk about how fluctuations in hormones affect how people respond to medicine, and how the medical industry in general just hasn't even considered women, and especially up until very recently?
Yeah, I guess both of us can attack
let's
that.
educate ourselves.
Well, I just like to say that estrogen and progesterone and testosterone, are the hormones that we all have it. And I think that estrogen receptors are all over the body. They're in your brain, in your bone, in your heart. And so when you have these fluctuations and eventually a decline, it only would make sense that the organs that are interacting with estrogen would not respond in the same way, which is why we start to see our bones getting weaker, heart disease is the number one killer of women.
Yeah.
Brain, when we think of Alzheimer's and neurodegenerative diseases, is because that estrogen is gone. And so I really find it fascinating when you understand like the concept of how everything is connected. It makes sense that why wouldn't we want to either replete it through hormone replacement therapy if you choose to do so, but just having a full knowledge of how your whole body works and how your body responds to hormones is that's construct the conversation and what then you can do later to help yourself.
Yeah. And it's so interesting that the medical community did not want to include women in research trials for many years. because the fact that we have so many fluctuations in our hormones entered too many variables into the scenario for them.
Yeah.
They didn't want to have to deal with that. They also would claim that, well, what if a woman got pregnant? Then we would expose a fetus to medication unnecessarily. But so many of us in this room, if you've ever taken any prescription medicine, those medicines were never tested on women. Isn't that insane
Do we know
to
this?
think about?
Who knew this? So not everybody.
So for a long time, we were little
It's
men
infuriating.
until we were like, no, actually, we're women.
Right.
We're women.
Yeah. And it wasn't until this past year that our own government has actually pledged to put money into women's health research.
Yeah.
So much time and effort and money has gone into male medicine. God knows we know how much money has gone into erectile dysfunction drugs. But those very same women that are in relationships and have male partners that are taking all these erectile dysfunction drugs aren't getting the help they need to even be receptive to have sexual activity.
Right.
Yeah.
Right.
It's insane. So now, I mean, it's turning the tides. You know, women are speaking up and demanding better. And that's what's most important, is that we need to take care of women.
Yeah, and of course, I am hyper focused on entrepreneurship, right? And maybe I'll take this time for those of you that don't know. I do teach entrepreneurship at both NYU and at Rice University. So I breathe it, I sleep it, I think about it, and I love it. So, but the one thing that I love, one of the many things that I love about Winona, is that here is a company that was started specifically to address problems that women are facing. So I hope that through this panel, yes, we're educated about our health. It's so important. We have to take care of ourselves as we're growing businesses. But you can look at Winona as a company that started because of an opportunity that was in the marketplace. And I'm listening to Nicole talk about the hyperbaric chambers and bringing it everywhere. There is another opportunity, right? That's an opportunity for franchising. So think about in your own lives, because we heard from the Women in Wealth panel earlier that women, are really just starting to invest in other women, and that when we go to male venture capitalists, they're not necessarily investing in these types of businesses. So we really need to make a case for why this is such a problem and how big of an issue it is. I mean, we are 51% of the population, right? So our problems, they're important, and our problems are definitely worth solving. So I hope that you look at this panel and you're inspired that you can look in your own life and create something of tremendous value that's for 51% of the population, for goodness gracious, right? Yeah. So
I've also heard something too, that like when women become wealthy, they actually take their wealth and help the general community around them.
Yes.
Men don't do the same thing.
I say this all the time.
Right.
Yeah.
So by lifting up other women, it's only helping the society as a whole.
Yeah.
In general.
And when we take care of ourselves, we can do better, right? And we can live longer and better. And we can, then bring those companies forward with us as well. So I actually kind of just want to ask everybody, we have just a couple minutes left, some closing questions. So if you could give one piece of advice for women looking to improve their health while leading their businesses, what would it be? Let's start with Erica.
Stress management. Stressors affect our hormones. Stressors affect our hormones affect our sleep affects our brain function. So if you are running a business or you have a huge project you're working on, or if you work for a corporation, you need every bit of brain power that you have. Stress and self-care are two things that get tossed around a lot. I would define what self-care means for you and really go into it heavily and honestly and deeply for yourself. And no small amount is too small, but stress management, I would say.
Dr. Shepard?
I would say two things, even though you said one, is, and this is specifically something that I've learned, and I tell it to my patients as well, is really mental wellness. The ability to tune into who you are, what are the things that are plaguing you, what are the emotions that you're going through, and actually sitting in them, rather than pushing them away and suppressing them and trying to numb, is that you can really grow when you go through those hard times and those emotions that feel so horrible is to push through them and have someone help you. And a therapist is always great. I advocate for therapy as well, because on the other side is really where you have that growth, those uncomfortable moments. And then the other thing that I would say is exercise and movement. It does not mean that you need to do a triathlon. It just means moving your body, especially as we go through mid-age. We start to lose muscle mass, our fat increases. So we're trying to increase muscle mass so that we can push away those fat cells that are uninvited guests, obviously. And I think that movement is going to, again, create you to be functional, your flexibility, your balance. These are all things that start to deteriorate. So as we have that well span and we want to show up in our best way in our 60s, 70s, and 80s, and 90s, and even 100s, is that you have the physical ability to do that. And that's going to be that investment that you put in with exercise now.
Nicole?
I would say balance. And that's something I really only learned myself in the last year. I actually run about 5 companies. And so it was like running to put this one up, then running to put that one up. And I never took time for myself. And so practicing what I preach and putting myself as a patient in my own facility was huge, because now people are like, what'd you do different? You look so much better. I'm like, oh, I prioritize myself and my balance.
Amazing. Dr. Kat?
I would say take the time to learn more about your health and your own body. One of my biggest pieces of advice for my patients and for friends is that get as much knowledge about health and about your own wellness as you can. Knowledge is power. And then help the other people in your life to learn more about their bodies. Learn about the anatomy and physiology of your own body. Be comfortable with what it feels like, different parts of the month and during the cycle and midlife. If you don't know, I mean, it's really hard to notice and to recognize when there's changes and when you have symptoms that might be bothersome. And you are the expert of your body, not the doctor that you see for 30 seconds or 30 minutes when you go to a visit. So, and arm yourself with that knowledge and that power. Bring information to your providers and give them the information that you need to give them to help them to take better care of you. But knowledge is power.
Love it. And Heidi?
I have one thing, but it's broken into 5, but I'll go
5.
So I have five little boxes I try to check every day. The goal is to check them off every day. I don't always get there, but I don't beat myself up over it. So hydrate, be thoughtful of the nutrition, put in your body, prioritize your sleep, movement, specifically weight training and muscle mass, and personal connection and connecting with people around you.
Community. I love that so much. So this is so exciting. We are going to have 10 minutes that we can ask our esteemed panelists questions. So who would like to kick us off with questions? Marcy.
I want to talk about the mental health aspect of hello.
Hi.
I want to talk about the mental health side of this, because when I hit perimenopause in my 40s, I hit it very early. And I don't think a lot of women even know that they can hit it that early. They think they have to be 50 and above. And in my family, they hit very early. So around 41, 42, I was going to my gynecologist. And first of all, she said, there's no way. So please advocate for yourself. When you know that you are going crazy in your head, there's something happening. And I literally went through, I realize it now that I'm actually sober, that I was going through a very, very mental breakdown at that time. And my doctors put me on an antidepressant. Instead of addressing what was really happening with me, and my drinking elevated, and that was one of the ways I was trying to numb. And you've mentioned that, don't numb. But I didn't know how to manage it. I was in front of the camera, trying to balance my home life, and it was hard. And I just would love to hear more about the mental health side, how that's being addressed. And this is something that's so important. Like I put this on my show all the time because it's such a priority. It's not just what it's doing to us physically, it's mentally.
And I think that's so important. That's why I bring it a lot into the conversation, is because we do see, and there's evidence that really shows that there's such a fluctuation in hormones, specifically during the perimenopausal phase. But estrogen also has a very close relationship with our neurotransmitters. And our neurotransmitters, especially the ones that make us feel happy, like your dopamine, those also start to have some type of dysfunction in the way that they didn't show up earlier in your life. But so you have these increase in depression and anxiety that go on during perimenopause. And so many of my patients, it's like an out-of-body experience where they're watching themselves go through these transitions, and they know that they feel that there's a mind-body disconnect, but no one is making that connection that it actually may have a lot to do with the transition that they're going through, which is perimenopause. And so now that we're starting to see a lot more evidence towards this time frame in life, appreciating the mental health aspect and the emotional health aspect of it is so key, because a lot of times that's how it shows up rather than the symptom that you're thinking of, which might be with your cycles or hot flashes and night sweats, because those are the physical features aspects of it. But the mental capacity of what is going on is so important, which is why I always advocate for maybe, looking at your hormones and trying to regulate those. But even in addition to that, getting the tools and how to navigate through those moments and not numbing, which is through therapy, or even, if you want to venture into ketamine therapy. But because of how, we're trained to fix a problem. And the problem is that you come in and you're saying, I'm having depression or anxiety, and we're like, here's an antidepressant. But it's so much deeper than that. So thank you for bringing that up.
And your experience is so common, because
Very
I would say
common.
probably more than 50% of the patients that I encounter at Winona are already on an ADHD medication and antidepressant before they even find us. And those are the early symptoms that are unrecognized as being perimenopause.
Yep.
Yeah.
It's, having brain fog, not being able to focus. And I'm sorry, but you're not going to get a new diagnosis of ADHD at 41. That would manifest when you're in your school years. It doesn't just happen overnight. This is all related to the loss of estrogen.
Yeah.
It's insane.
I want to just add one thing, because I do know for 100% sure that we have several mental health professionals here in the audience today. I would love for you all, I think there's 3 that I know of. There's maybe more. I'd love for you all to just raise your hands or stand up. And there's even a podcast here, Therapy Deconstructed. So I highly recommend seeking out mental health, because sometimes it's also shameful, right? I don't need a therapist. I can figure this out on my own.
We need to shed that stigma and make it a very integral part of medical care and healthcare.
Well, I just think that why would we expect that we have the tools to take care of something that's going on with our mental health if no one gave us the education behind it? Exactly. How am I utilizing a tool that I was never given?
Right.
And that's what therapy is helpful for, is to giving you the tools, because we are going to go through these things in life, but what do you do when they're there? And we've been trained, and society has told us to numb it and just push it away. That's the complete opposite of what you should be doing.
Love it. Heidi?
Yeah, I just want to add to that. When my family kind of got popular on social media, and my kids purposefully shared their mental health journey, which was not always pretty, online. And I talk to so many people, moms that say how much my daughters helped their kids to sort of advocate for their own mental health. But I always say, what about you? Because when your kids are going through it, you're going through it.
Yeah.
And then add all the other stuff on top of that. So, for me, I try to remind the moms and both parents too, what about you? And don't forget about your own mental health, because, like we do, we just take care of everybody else. So.
Any other questions? Oh, Olivia. And then Ruchi.
Hi, I am actually a mental health psychotherapist specializing in perinatal mental health. Should I stand up?
Yeah, stand up.
So thank you for asking a question about mental health, Marcy. I've actually been on Marcy's show before talking about this. And I currently specialize in trauma-informed care. So I wanted to ask you all about trauma-informed care, because when we're talking about women's bodies, when we're talking about reproductive health, mental health, maternal mental health, I think part of Marcy's question was, what do we do about this, right? What are we doing about this? I think one answer is providers focusing and learning what trauma-informed care is. So I wanted to ask you guys, so I'm co-founder of the Trauma-Informed Maternal Health Provider Directory, and something that we focus on all the time are these pillars of providers specializing in safety, collaboration, cultural responsiveness, mutuality, peer support. And I'm wondering, at Winona, or just providers in the field, is that a framework that OBGYNs and people on the more medical side of things, as opposed to the perinatal mental health therapist side of things, is that something that you guys are talking about more and more? Is it something you're being trained in more and more? And is it a language that you guys use in your realm? Just so I can learn more about that on the mental health side of things.
I can tell you, for the first 15 years of my career, I'd never even heard the term trauma-informed care. I was lucky enough to work at a hospital that was involved, I'm just in the Philadelphia area, which is actually where a lot of the ACEs research was done, was at the University of Pennsylvania. So I was lucky enough to be able to attend a 15-hour course on trauma-informed care for physicians and healthcare providers. And it has completely changed how I take care of patients. What I remember as an intern, finding women that would show up in labor with absolutely zero prenatal care and wondering, what the hell is wrong with them? Now my question is, what happened to them that made them so afraid to come to our office to get the care? And at the time when I was in my training, I was actually in the Army. They paid for my education. And so the care that I was providing was absolutely free. Women didn't have a copay. They didn't have barriers to get there as far as transportation, but we would still have women that show up with no prenatal care. And most of the time it was because they had one traumatic experience, one very painful exam, or someone that belittled them or didn't listen to them, and it completely reframed their entire trust of the medical community. And so I think it's really important. And now bigger health systems and especially medical schools are starting to infuse trauma-informed care into their curriculums. I mean, not enough time is spent on it, just like not enough time is spent on nutrition in medical school either. Right. I think I got 1 hour in 4 years. So much of what I have learned about health and wellness has been from my own seeking of the education as I've gone through my career and as I've developed as a physician.
I'm glad you gave a better answer, because my short answer was like, no, doctors are not getting this training, especially in trauma-informed care. You know, in my practice specifically, we have life coaches, trauma-informed yoga specialists, and that's something that was new to me, but it was very self-taught because if you look at society, the body holds score. And a lot of what we hold is in our pelvis, especially for women, and that comes out in how we present, what we're willing to share, the stigma that comes around it. And so I specifically in my practice really do focus on the mentality of what happened to you in the past and how are you holding that childhood trauma, you know, how we associate with others and what are attachment disorders. And that has a lot to do with what we're willing to explore in our healthcare, but also our mental wellness. So very big part of my practice, but it's not a big part of medicine in general. But we are starting to see it, but medicine is very slow. So I would say maybe in the next 10, 15 years is where we might see that as a full integration.
I'm going to ask this question again. Well, I'm sorry we do not have any more time for questions, but who would like to see this as a day-long discussion? Right? Okay, so I like this. So I just want to thank you all so very much for sharing your wisdom and your expertise with us, educating us, and I think just making us feel really great about where we are in our journeys. And can I please ask that if anybody has any questions, will you be around? Okay, amazing. So thank you very much. Let's give a round of applause for our amazing Winona panel. Incredible. Thank you so much.
Thank you.
Okay. Now we walk up and we dance.
Oh, we dance.
We dance. Actually, why doesn't everybody get up because we're sitting? Who wants to be sitting? Not me. Not me. Let's dance. This is so good. Ready?
Oh yeah, it's coming.
Ready?
It's coming. The beat's coming.
Come on.
This girl